call the City of Franklin Board of Health meeting to order May 8th, 2023. At this time, Dr. Golden is not here yet, but is present in the building. Same with Alderman Barber, and Pat Neeson is not available. She may be here late, though. We need approval of the minutes from April.
I'll make a motion to.
Okay. Have a second?
Second.
Any discussion on it? All in favor of approval of the minutes for Monday, April 10th, say aye.
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 Opposed? Okay, so we now have approved the minutes from April 10th. Before we move into citizen comment period, oh, hi, Dr. Golden. We have two new members to the Board of Health. And I just want to go around and first give our hellos and say a little bit about each other, and then we'll have the new members say a little bit about themselves. So I know you wanted us to answer a few questions.
Yes, if we could, and if you feel comfortable with sharing, for those who are around the Board of Health, I would love if you can share approximately how long you've been a member of the Board of Health, just so that our new members have a good idea of what we're made up with around the table. How you currently support health in Franklin, or what you do to promote a healthy community in your personal or professional life, and then what excites you about serving on the Board of Health. What makes you passionate to fill this role and be a Board of Health member for our city? So I can kind of introduce where I'm coming from a health department standpoint, and then we can pass it around. But Lauren, the health officer, I've been with the department about 7 years, serving as the health officer now for about, actually, to the date, 1 year today. So I've been with you guys a year. Currently to support health in Franklin, we're really working to try to have robust collaboration through all parts of the city of Franklin, include all different community members to get projects moving forward to advance the health here locally. And I'm excited to be able to collaborate with all of you and see your strengths brought to the table to help support Franklin.
Okay, my name is Henry Winchaleski. I'm a general dentist. I've been on the Board of Health for probably around 30 years, and I've been chair for about 25 years. I come from a family that's always been involved with health. My father was a general surgeon. My wife works for the hospital setting. So I've always been involved and been interested in the health field.
I'm Wayne Husted. I think I've been on the board 5 years, something like that, when Bill left. As a retired pharmacist, I guess I hope to bring an added perspective to the Board of Health. I know a lot of them are nurses, and hopefully the health department is an asset to the city and showing how different ways to have a healthier environment and that type of thing.
Thank you.
We're going to come back to you, Deborah.
Okay.
Can you remember? Ellen, why don't you go ahead and introduce you?
Hi, my name is Ellen Henry. I'm the public health specialist with the department. I've been with the department probably about 3.5 years now. Formerly with Volition Franklin as the coordinator, but now kind of dabble in a little bit of everything as the specialist. I used to work with a lot of environmental health stuff when I did worked in nursing, but I'm just excited to see what we can do to bring more exciting projects to the city and help improve health for the whole community.
I'm Patty Golden. I am a family practitioner by background. I've been living and working in the Franklin community for the past 20 years. I've also, Wayne, thank you for saying how long you've been on, because in my mind I was trying to figure out, has it only been 4? But I was on before you, so I must be like...
Whenever it was when Bill quit, because that was like his last...
I guess maybe 6 or 7 years. I've been the medical liaison for this board, and I got involved because it's important to me to help keep our communities healthy.
Thank you, Pat. We're sharing a little bit about our history with the Board of Health, and then what you do to promote health, or what interests you in serving on the Board of Health.
Okay. Well, sorry I was late. I had a little operator error with my Fitbit. But I'm Pat Nissen. I've been on the Board of Health how long, Henry?
It's over 30 years, probably.
I'm embarrassed to say it's been that long. Henry and I were a long time on board. And I think I first got into the board when I was actively working in healthcare. I was a nurse by credential, but I worked more in the administration area. So I oversaw some systems, I guess, that I found very interesting, and the Board of Health kind of fed into that in my mind for my local community. So I just stayed on the Board of Health over the years, and I grew with it, and it grew with me, and I don't know, it's been a while, and I've enjoyed it. I've enjoyed watching my local community be concerned about the health of the people that live around me, you know. It's been nice. So, thank you.
Thank you.
And who are we sharing?
We're introducing this to our new members, Debbie
Oh,
Davis,
okay.
and
We'll introduce them to you in a minute.
Lots of people in
Yes.
the room, you know.
and we have some guests.
Okay, I'm sorry. I thank you and welcome.
My name is Mike Barber. I'm an alderman in the 5th District, Franklin. I've been on the board for 7 years now. I've learned a lot about health, public health, since I've been on this board. But my main function is to take the concerns of this group to the council and to promote or to be part of it, to make the presentations to the council when needed, and to just kind of be the liaison between the council and our board. I've been on it. It's been very enjoyable. I thought I might have to come off, but I don't.
I heard.
I don't have to come off. So I'll continue to be on it, and like I said, it's been a very enjoyable board. I'm pleased to serve this.
Amy Marzalka, my husband and I moved to Franklin 3 years ago, and I joined the board about 2.5 years ago. Currently I'm working for Ascension. It is in a IT aspect, but prior to that I worked for, actually have it on the Washington Ozaki Public Health Department as a public health specialist. My background is in public health. Before that probably worked in it for about 12 years. I'm also a car seat technician, so still very passionate about health, even though I've transitioned to the healthcare setting, but I'm working in IT. But excited to be a part of the community and the board, and promote health in any way I can and make sure that the community is focused on being healthy and fit.
Okay, so those are the members right now. We're going to introduce our new members. Deborah, why don't you start?
Thank you, Debbie Davis. I've been on the board for about 7 minutes. And I am a clinical mental health provider, a psychotherapist, and I am really interested in how we can further mental health from a public health perspective. So that's my interest. I've done a lot of advocacy in different areas and with the city. So I'm used to thinking big picture, but not so much with mental health. Although I've done training with, I was certified at one point for the mental health first aid, but most of my mental health work has been clinical. And say my father was a social worker, my husband is a social welfare professor at UWM and specializes in trauma, so it's also been a family thing for us, the mental health. So I'm happy to be here. Thank you.
And Jim.
My name is Jim Roglovich. I'm a retired orthopedic surgeon of 52 years. I practiced on the south side of Milwaukee. I was one of the 25 people that started the Mosh Hospital here in Franklin. My background is I was one of the presidents of the State Orthopedic Society. I've represented the orthopedists at the State Medical Society for 18 years, and for 6 years I was a counselor for our Academy of Orthopedic Surgeons. I was one of 125 people who helped run our Academy of 18,000. I've been living in Franklin now for a little over 30 years. I was very busy, and now is my time to get back to the community. That's why I'm here. And I'm willing to roll up my sleeves in any way I can to help people.
Wonderful.
I'm willing to learn, put it that way.
Great.
Thank
If
you.
you're wondering, Jim is not part of the board right now because he still has to give his financial disclosure and take his oath. So, okay. We are going to then move into, we have a few citizens here, and I would imagine they have a few comments. So what I'm going to do is, it's just a three. Did you want to make any comments? You're just observing?
Yes.
Okay, we have people observing from Alverno College. It's a class that they are taking. Okay. I don't know who wants to start.
We'll just have the individuals state their name and address.
Sure.
Okay.
Thank you.
Joy Draginas Angalis, 7573 Highview Drive. So I'm Greendale, but I literally border Franklin. As I stated before, I have a biology background, I also have an education background, and I'm also a small business owner. I felt it important to come today because seeing that it is Mental Health Month, I wanted to address the board and I guess bring to light the concerns and issues that my family has had, my community, as well as the surrounding neighbors to the Rock regarding the noise. I've done some studies at Alverno when it comes to mental health and noise and the effects and children and noise. And I was going through some of my material. In fact, I brought up something from Harvard regarding noise and how it affects mental health and your health, period, and your overall well-being, even your attitude. And this is something that I felt was very well written by Harvard and kind of sums it up. But there's so much more material out there, and I think over the years of all the noise complaints that have come through regarding the Rock, I think it's something that needs it needs the eye, I guess, of the health department. And we brought this up before, just never realized coming to the meeting. So, but in this read for Harvard, it states that the EPA has deemed noise pollution a growing danger to the health and welfare of the nation's population. The European Environmental Agency also is stating the same thing. It poses a threat and is often underestimated. What the noise, continuous noise, can do to someone's attitude, their cognitive abilities, their ability to focus. I'm thinking of my children. I have a son, he has sensory integration disorder. And when he's woken up at night by the Rock, he wakes me up and we go outside and actually swing on the swings so he can relax. But when you're outside and the noise continues into your backyard, it's something that it's this hamster wheel. We can't get him off because yes, the swing is soothing and it's relaxing for someone with SIDS, but that noise is still there. Another thing that the research has shown that noise pollution not only drives hearing loss, tinnitus, hypersensitivity to sound, but can cause cardiovascular disease, type 2 diabetes, sleep disturbances, stress, mental health, and cognitive problems, including memory impairment and attention deficits, childhood learning delays, and low birth weight. To me, that stands out again and again and again in the research that's being done, and especially a lot that's being brought to the forefront regarding noise. This is something that the neighbors, we have spoken about for years regarding the Rock. And now I guess we're looking to the experts and hearing and you've worked with us before regarding this and the effects on children. I really do believe that this is a health issue. This isn't just, we don't want it in our backyard. It's really affecting us. It's affected our families, it's affected our sleep, and it affects our attitudes. And as you can see through the years, we've gotten actually a little more, I guess, intense in our responses. to the people involved that aren't helping us, that aren't protecting us and the community. And it's hard because me being a Greendale resident, I often get, well, you're in Greendale. Yeah, but you chose to put this on my border. So you have to listen to the Greendale residents and take us into consideration as well. That's really it. Thank you.
So if you could give your name and your address.
Sure. Dale Kerner, 8630 West Hawthorne Lane. Can everybody hear me?
Yes.
You couldn't hear me yesterday if I was in my backyard talking to you. The game was taking place and they were screaming on the PA. This is not a 3-day event like a church carnival. It's an ongoing thing. Some say 180 days a year. I say it's 360 at night, sometimes in the winter when I'm sleeping. I'm waking up, I'm going, what the heck is that noise? I hear a humming. I'm going, the furnace isn't running. You know, what motor did I leave on? They're using, they're making snow on the rock, on the thing. It doesn't have to be done. I mean, you can actually hear the humming. You know, my grandkids can't sleep over in the summer because the rock is, they got fireworks, they've got everything going on. And we're here because our quality of life has been taken away. Yesterday, Sunday, I'm in and out a little bit, and I'm inside, and the phone goes off, and my neighbor next door, John, calls and goes, Dale, how can you put up with that? I said, I can't, John. I said, I already called the police, and I already put an online form. He said he was talking to his son, who graduated from Iowa, and his son said, Dad, what's that noise in the background? John's inside his house. And his son can hear that. That's how bad it is. And it's screaming, it's blaring. I mean, you guys should come to our neighborhood. It's just, our quality of life is completely gone in the summer. And I feel even sorry more for Joy because she's getting dumped on and she has no say because it's not on her, you know, her government thing. And we've been fighting this for years. We brought this to the Common Council, to the city when it first started. Noise and light were going to be a problem. The mayor at the time, Olson, said, no, they got a way to mitigate sound.
It was Taylor and Olson.
Yeah, Taylor and Olson, we got a way to mitigate sound. And then they came up with this 79 decibels that it's just floating in the air that there's some formula out there for 79 decibels. There is nothing in writing that allows this man to put out 79 decibels. The city says the county said it's okay, the county said the city it's okay. Neither of them gave approval for such a thing. And this is not like a church festival. You say, okay, you know, 3 days out of the year,
Right.
hell, everybody's having fun, do it, you know, and it's over with. No, this is an ongoing thing. And I probably live, I'm saying maybe a block away. Would you say, Dana?
A little more.
A little more than a block away. And
800 feet, 900 feet.
and it's just not the baseball games, it's the umbrella bar. And that, I mean, I come home at 11 o'clock at night, 11:30 at night, and the noise is gone. There's one time, it's 2 o'clock in the morning, I'm hearing music. I go, what the hell's going on? I call the Franklin Police Department. They said they'll look into it. I thought, you know what? I'll put my clothes on. Somebody's having a tailgate party at 2 o'clock in the morning on the Rock property, and they got their stereos turned up. And you got your windows open, and the air, or whatever you call it, the wind travels the right way, and you're hearing it, you know. And, you know, this is not the quality of life that I want. You know, we pay taxes. We were there. There's neighbors in my neighborhood that have been there since the 70s, and they have to put up with this. And they're just, everybody's just frustrated about it. Thank you.
Sure, Dana Gint, 9011 West Hawthorne Lane. I live over a half mile from the Rock, and just as Dale said, I have recordings of inside my home. I can hear the announcer inside my home. So there were games from noon yesterday until 8 o'clock at night. The UW Panther games weren't quite as loud as Milkman because Milkman has all the advertising and promotions, and they have music playing constantly in between people, I don't know, running bases or whatever. So it is nonstop, chronic noise. It's not, as Dale said, a 3-day church festival. It's 130 days. For example, next week there are, I think there's 11 events. Let's see, I have my calendar. I carry my calendar wherever I go regarding the events at this location, so I know when I can't have people over, or like what I need to deal with to try to get my children to sleep and things like that. There's 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 events next week, just baseball games that they go for, obviously baseball goes for 3 or 4 hours at a time, including the pregame, after-game, music, and things like that. It's just an atrocity that the health department has allowed this to impact our lives for 10 years. It's going on 10 years. We have been pleading with every different committee to please help us. Alderman Barber brought up and asked at the recent meeting on the Committee of the Whole, asked the staff, if anybody's ever looked into what is a safe decibel level. Has an audiologist ever been involved? Has anyone looked at any of this information? No one has. How can you possibly put a stadium within 700 feet of the residential property line without any information regarding the noise impact? There was no environmental impact statement done. There was no environmental study done regarding the noise. It is just negligent and atrocious that this has been going on for 10 years. It hurts my well-being. It hurts my mental health. And I was listening to one of your audio tapes about you guys did this health survey. Did you survey our neighborhood? Did you knock on doors? Where was this survey? I don't see anything on your agendas that has this plan that you guys are working on. And so does this new plan include mitigating the noise for our neighborhood? And as far as every time I go to the doctor, I bring up the stress level and that this harms me and that it stresses me out constantly. My life is full of stress. As Dale said, there is a motor that's running 24 hours a day, well, it's from 10 o'clock at night till 6 in the morning. The snowmaking machines, they have 16 snow cannons running that it sounds like there's a generator sitting outside my bedroom window. That's what it sounds like. All night long. You cannot sleep, you can't rest, your body needs to get away from this. So I actually typed up a resolution for you guys because it's pretty clear that nobody will help us unless we do it ourselves, which is what we've been doing for 10 years and we've been ignored. So I typed up a resolution. What needs to be done is that on this, even though the licensing committee recommended 2 pages of recommendations to help mitigate the noise, that didn't go anywhere. That was done in February. That didn't go anywhere. In March, the environmental committee made a page of recommendations regarding mitigating the noise. That didn't go to the common council either. Nothing's being done for any of us. So I actually typed up a resolution to give to you guys. I'd really appreciate you approve it. It's that you guys prepare a report on the health impacts of noise and present it to the common council, and also to put a hold on all the other permits related to the Rock Sports Complex that have any kind of amplification system. I don't mind charity events. I understand that that's very heartfelt. I know that there's a purpose for that, but just having a party over there that keeps my family awake till 11 o'clock at night, or the Hills Has Eyes thing, it will be going till midnight. They want to extend the hours till midnight now. And then during their presentation, they said the activities go for an hour to an hour and a half past that, which it doesn't matter because every year for the last 10 years, they operate till 1:30 in the morning anyway, so I don't care what the permit says. That's not what they do. So I've typed up a resolution. I would like you to review it and possibly approve it, that you're going to put a hold on approval of all events at the Rock until you guys put together some sort of report on the health impacts that is harming our family, because this needs to stop. It's unacceptable. We pay $8,000 in taxes. I believe your mission statement is to protect and promote health and prevent injury and disease in the Franklin community. Well, there's hundreds of people that are impacted. Elected officials have spoken, committee members have spoken, citizens have spoken in the last 6 months that they can hear it 2 miles away. 2 miles away. They can hear it on their property, outside of their yard, in their yard. That should just be alarming to all of you. And then the other thing is that your vision statement says to create a healthy Franklin where all residents are able to meet their highest potential. Well, I can tell you, my kids can't sleep at night. They are not meeting their highest potential. So I'd appreciate your consideration, and please help us.
May I speak again? Is that okay? Okay. Yes, very briefly. And we all, please don't, we're not here to say shame on you. And I understand there's been a lot of not one board not speaking to another board. That's what we've become very aware of in Franklin. So I'm going to assume that most of you haven't heard a lot about what's been going on regarding the noise. I'm not sure. But it's something, I'll say for Dana, I've known Dana and her husband and I worked very closely together from the beginning. Dana was a much more mild-mannered person when it came to the Rock prior to this. It has stressed her out. Again, as the studies show us, the anxiety and stress levels go up as the noise continues and continues. And think about 10 years of this noise continuing for all of us. I can't keep my windows open at night in the summer. That's not fair to me. Why? I can't even open my windows because it's so loud. at night, even with the windows closed, the air conditioning on, my ceiling fan on, the TV on. The other day I had to call the police department because I kept having to turn my TV up. There was bass coming at, 9 o'clock in the morning.
Yep.
I'm like, this starts for me at my house because we're close to I'm right across the street from the Rock, by the Little League fields. It starts at 7 in the morning and it goes till midnight, 1 o'clock, 2 o'clock in the morning. Think about that for 180 plus days out of the year. 79 decibels is equivalent. I registered my vacuum cleaner. So think about your vacuum cleaner right next to you 24/7, because that's what the police department is saying. It can be 79 decibels in our homes before they will do anything. And it has to register for 30 minutes before there's a violation. That's just ridiculous. So we're pleading. I mean, we truly are pleading. And I know many of you know the effects of what noise is used as torture from other countries. So we feel like we're being tortured. Thank you.
Thank you for your comments.
Okay. Well, definitely it's not on our agenda for this evening, but we will put it on the agenda for June.
That doesn't solve our problem.
That is not on our agenda for this evening. So we will talk to the city attorneys, the council people, and what you brought in, and then we will discuss it in June.
But mental health is an ongoing thing. Why can't you address it now?
We don't have all the information, we just have from me 3 people.
Is there a
We-
way?
Do you need hundreds? I have a
We
thousand.
need
There's a
Right,
thousand
we need the
complaints.
city attorney to talk to us
There's
today.
been 1,000 complaints filed. I'd be
Yeah.
happy to,
Well,
Alderman Bauer.
Procedure-wise, we cannot do it until the next meeting where it can be an agenda item. We have to limit
Yes.
our discussion tonight as it was pre-announced by form and whatever, put it up there. It has to follow that agenda. We can't introduce because of the transparency and everything else that comes into play there.
Is there a way to work on it prior to that meeting, though?
Definitely. We'll do some information gathering and we'll put it on the agenda for next one.
I just want to, your house is your oasis. And it's anything but that. It's anything but that. It's like you don't want to be there. And so they had monitors up there. And they said, we called the police, well, they're within the monitor thing. Well, the monitors have been working for like 3 years, they tell us. Was that?
Yeah, there's 2 of them.
Well, how can this happen? This is a violation of law, if you ask me. It's like having a speed limit, but you don't have to obey it.
Well, they do.
Thank you for your comments.
thank you, and it will be addressed.
I would bring to the table the fact that working on the monitor, the 4A monitoring committee, which was established, is something that maybe we could propose at this point too, as a health department being part of that to understand what's going on. As one citizen to another, have you ever tried an injunction?
So why do we have to go through the costs of hiring an attorney?
Well, I'm just asking, I'm not saying you should, I'm just saying, has there
Right,
ever been
exactly.
the thought of enjoining the Rock? Because it's a county issue, it's a state issue,
Right.
it's a city
And that's
issue.
the
At this point,
problem
though,
that we run
to
into.
continue this meeting, we will have to close the citizen comment period. But we will not abandon this.
Thank you.
And I just want to say if there's any work to be done between, I'm happy to contribute. I just passed out the article you mentioned
Right.
about Harvard and also the PA article, so.
Okay,
Thank you.
thank you. Okay, and I do not believe there's any unfinished business, so we're going to move right into new business and the meeting schedule discussion.
Yes, Henry and I have discussed how the meeting schedule.
Did we pass last month's minutes?
Yes, we did.
Okay.
Yes, we did. Thank you. We were talking about the meeting schedule and the outlook for the 2023 calendar of meetings. We have had in the past some issue to meet quorum, just given the expectation to make every month meeting out of the entire year is really taxing on board members' times. But we do have the requirement and expectation that we would all be coming to the table quarterly. So Henry and I were looking to propose a possible quarterly schedule I think I may modify that now to make our proposal to leave June's meeting on the calendar,
Yes.
given tonight's discussion. But to meet quarterly now moving forward with having already met in January, April, now June.
Yes.
And then would you propose October?
I prefer the beginning of the quarter as opposed to the end of the quarter, in case for whatever reason that meeting is canceled. We still have another month or two to make that quorum for that meeting,
Okay.
or that quarter.
So October then
October would be fine.
So if you want to raise that to the group,
Sure.
we would need a
Are we-
motion
Okay, well, does somebody want to make that motion then? I can't
or a
do that.
discussion.
Is that just a discussion, is that subject to the call of the chair
Oh, absolutely, it's always is.
for a special meeting as part of the
Absolutely,
language?
yes. So I would need a motion then that our meetings be once a quarter as opposed to twice or so a quarter. Unless an issue comes up that we have to meet for.
So move.
Okay,
I'm not moving, so.
yeah.
Oh, yeah.
Do we have a second?
Second.
Okay, is there any discussion on that now?
But we will hold one in June.
We are holding it in June and then the one after that would be October.
This will be an agenda item for June.
Yeah, it will. And then if anything comes up, we usually took July and August off, but if something comes up, then we would always ask for a meeting. Okay, hearing no discussion, all in favor? Aye. Any opposed? Okay, we'll move then into Health Department updates and the Community Health Improvement Plan.
Thank you. I'm happy to lead into this next discussion. For our Community Health Improvement Plan update, we'll be talking about the General Community Health Assessment and now the Community Health Improvement Plan that has come for that. Thought it would be nice to be able to bring forward a Public Health Department staff member each time we meet to just talk a little bit more about our program. So that is why Ellen is joining us today. So she'll be giving a little bit of an update on where we are with that process. As a reminder, that's the group of organizations, partners, community members that come together about once every couple of months to progress projects forward in Franklin. And I'll let you take it away before I get too in the weeds about it. But Ellen will be sharing about where we are with that right now.
All right, so this is just going to be kind of a very generalized update on the progress in our community health improvement plan. I apologize, it's a little blurry to see. We don't really have control over the lights in this room, unfortunately, but just stop me if you have questions and we can keep going through. So because we do have some new members joining us tonight, I thought it would be relevant to give a little bit of an overview on what exactly a community health assessment as well as a community health improvement plan is. As defined by our CDC, CHA, or Community Health Assessment, refers to a state, tribal, local, or territorial health assessment that identifies key health needs, issues, through systematic, comprehensive data collection and analysis. So this is a process we went through about a year ago, kind of through different qualitative and quantitative assessment processes. We've discussed this in several of our past meetings, so through community surveys, focus groups, as well as key informant interviews. Which leads us into our CHIP, our Community Health Improvement Plan, which is our long-term systematic effort to address public health problems based on the results of our CHA activities and the community health improvement process. This plan typically takes place every 3 to 5 years. In the past, I believe we're on a 5-year cycle. Moving forward, I believe we'll be transitioning into a more regular 3-year cycle. So why complete a CHA and a CHIP? The CHA and the CHIP gives our organization comprehensive information about our community's health status, needs, and issues. This information can help us develop a plan and justify how and where resources should be allocated to meet community needs. Benefits of our CHA and CHIP cycle include improved organizational and community coordination and collaboration, increased knowledge about public health, as well as the interconnectedness of different public health activities throughout our community, strengthened partnerships with state and local public health systems, as well as other community organizations, helps us identify strengths and weaknesses to address quality improvement efforts regarding health in our community, as well as benchmarks for public health practice improvements. CHA CHIP in Franklin, like I mentioned, our last cycle, we were on about a 5-year cycle, so our last CHA CHIP cycle completed in 2020. Obviously, given the pandemic, we had some unforeseen delays that did delay the next cycle of our CHA CHIP, but currently we are on cycle to have a 2022-2025 be our cycle for our next improvement planning process. So out of that CHA CHIP work, we have convened our Community Health Network, which we have discussed in depth in a few of our past meetings. But two events that led to the development of this network was our June 2022 Community Health Partner meeting. At that meeting, we led partners throughout the community, about 40 different community partners, through a data walk on different health assessment information that we've compiled, which led to the selection of 3 priority health areas for our community health improvement plan. Our January 2023 meeting, we also had the full presentation of our completed, or completed as thus far, CHA report. And then that conversation also led into a resource and a gap analysis collaboration with our partners at the table. The priority areas identified in those 2 meetings are physical activity, mental health, as well as an overarching community connection. So what we can do to increase just connection in the community, and how connection relates to physical activity and mental health as well. CHIP vision, obviously we want to create a healthy Franklin where all residents are able to meet their highest potential. At the Franklin Health Department, we are committed to protecting and promoting health, as well as preventing disease and injury within our community. Our services are informed by the community, and our work is driven by the passion of our health staff to promote health. How we make a difference. In our health department, we provide services for the community based on need found within the CHA. We are also forces for change, so we take data, trends, health behaviors, and community feedback to drive work. We also are engaged within our community, so ongoing partnerships and relationships with stakeholders, volunteer networks, and community-based coalitions to help make sure our work is a fit for our community. Moving forward, we will be convening our Community Health Network again in May, actually this week. So on Thursday, we will be outlining the strategic planning kind of process that a smaller subset of the health network has gone through to define a vision and a mission for that group. And we'll also be moving forward to select some goals, objectives, and strategies for the community health improvement planning process. Looking ahead beyond that next meeting, we will have anticipated future quarterly meetings to discuss different Franklin Health Collaborative initiatives, as well as kind of a continuous assessment on how we are doing and meeting those objectives and strategies. So, yep, just kind of general overview. So, thank you.
Are there any questions for Ellen?
How do we find the data, and how can we, can people still, is it possible to get involved with the health collaborative, and is it on the website at all, the data from the survey?
We're working to complete our community health improvement plan,
Okay.
and that will be compiled with a community health assessment, and then that will be published on the website.
Okay.
I'd anticipate probably within the next month or so that should be completed, and we will probably have a digital copy available.
Okay.
Yep, there's definitely still opportunities to be involved in the health collaborative. I know with the Board of Health members, we need to be conscious of not reaching a quorum. So I think, Amy, you might go into the next meeting. On Thursday, yep. But definitely opportunities for other partners if they're involved in the realm of health in Franklin. They're welcome to join the table.
Great.
Thank you, Ellen.
Any other questions for Ellen? Thank you very much, Ellen. Okay, we will then go into health officer report.
Thank you. As many of you know, Henry and I have been troubleshooting the best way to get that ServNet data out to the group. So an unforeseen issue that we had is actually when we were doing the summation of quarterly data, I realized that if we were to report monthly and we couldn't suppress data, that's why we decided to go to quarterly, well then we would have nothing to report on the other months. So
we already received it.
Yes, I decided, so the new Mayor Nelson had invited each department head to come present to the Common Council and just share a little bit about the department. And our turn is next week on the 16th. Henry and I are attending, and then health department staff who wish to go to show support in the audience. But I made this as a little mock presentation of what we might bring forward, and I would welcome your guys' feedback of any changes you might like to see when I bring this forward on behalf of the Health Department and Board of Health. But ultimately, this is the data. This is not the exact data that we would get in a quarterly meeting, but it does involve a lot of those same aspects. I thought it would be important to highlight the framework that we use as a state and local health department with the foundational public health services. So on the bottom there around foundational capabilities, those are all things that we're very familiar with from our day-to-day duties in the health department. And then the foundational areas are those that we focus on a regular basis. So you know that all of our programs focus such as our immunization program, chronic disease and injury prevention, maternal child health, access and linkage to clinical care, environmental health with our DATCAP program. So that just gives an overview for those who might not be familiar with it. This won't be on every report that we have because it's so common. But moving down, giving more of a narrative update for the Board of Health. So highlighting National Public Health Week, which was April 3rd through the 9th. So this is all April so that we could include some of those service numbers. But here locally, we highlighted our team and talked about some of the things that we're doing to promote health here. The RX Summit is the conference that's focused on prescription medication, and Volition Franklin, the health department, fire, and police department were able to be represented at the conference this year in Atlanta to learn best practice around harm reduction and substance misuse prevention. So that's really neat, and you'll see their picture on the next page. And then the re-highlighting the Franklin Health Collaborative that Ellen just presented on. So bringing this forward to the bigger body again to just continue to raise awareness of that group and then bring people to the table. So this month is when we're solidifying that vision, mission, goals with the group. So on the next page, you'll see that picture that you've seen before about the Franklin Collaborative, and then below it is Megan Conway, our coalition coordinator, and then Shannon Antoine with the Assistant Chief of EMS for the fire department, and then Officer Wallace, who is with our Franklin Police Department. On the left-hand side there, you'll see all of the activities and events our department was involved in the month of April. So the immunization clinics that we do the first and third Wednesday of the month, the tobacco poster contest, which the health department has hosted with the Board of Health support for many years, which is when the Franklin Public School students make tobacco prevention posters, so promoting why it would be a healthy choice not to engage in smoking tobacco or vaping. We had a resource table at a My Ascension event with the public schools, so that was focused on mental health and suicide prevention. And a really neat new thing that we've been doing is a lot of the elementary schools have been reaching out to Volition Franklin to be present at their science nights. So a new take on how health can be at the table and maybe more of a non-traditional space, but bringing a smoking model forward and then just talking about joining Volition Franklin as both elementary-aged parents and then middle school students to kind of have that multi-generational focus on being involved at the civic level. A little summary of our services. We did 16 environmental health services. So those include those licensed establishment checks, or inspections, I should say. Last meeting, we talked about how many we have in Franklin, and I told you guys I didn't know the number off the top of my head. I was pretty close, but it's 156, 164-ish with schools. But those are the places that are pools or retail food establishment, serving meals, things like that. So we had 16 encounters with that, 67 communicable disease follow-ups. Health and Human Service referrals are those that the PD or fire or a citizen may go in, and an individual that they live next to may have had a fall and can't get up and need some resources to like some gait or further care, maybe a hoarding, maybe a mental health crisis. Like people who don't necessarily have direct service with the hospital encounter, but they do need some assistance. So we had 4 of those this last month, and then direct service 32. Those are things like someone coming in for a proper sharp disposal, a blood pressure check, a car seat fitting, different services that the health department provides. We had 12 volunteer hours, but we had really 92 if you count the time spent at conferences that individuals from coalitions went to learn more about and support health. But we had 12 volunteer hours. And then a little save the date for the Common Council and for yourselves of things that are happening in May. So some of them may already pass because we're not meeting until the 16th with the Common Council, but thought it would be important to put it on here. But we're having the nutrition series. So the health department wrote for funding to be able to support nutrition among older adults here in Franklin, and we popped up a series that is meeting people where they're at. So we're going to have 5 sessions total. 3 of them are happening or have happened right in the very recent past. We did one at the senior dining program, so when the seniors meet at Root River every month on the first Wednesday of the month, and that served about 125 people. So we had a facilitator lead that on just the general concepts of healthy eating and how to modify a recipe for 1 or 2 people. We had one actually the day before at the health wing here in the health department. We're looking to host one at a senior living facility, and then we'll be doing 2 more or less maintenance sessions in the summer months. Again, out in the community so that people both can learn about nutrition, have a way to come together and meet friends out, and then really have that self-efficacy to be able to cook a healthy meal at home. And then also with that funding, if an individual qualifies, it's really age and income parameters, but most every senior that we've had talked to has qualified. They also get a free crock pot, and we'll be giving nutrition recipe cards out to them and a healthy eating kit of a few different ingredients that were involved in the recipes. So that's just a really unique way to interact with a different population here in Franklin. We were at the Arbor Day, so Ellen and Volition Franklin represented the health department at Arbor Day here in Franklin to promote getting rid of prescription medications in a safe way for the environment instead of just flushing them down the toilet. And then also doing some tick and Lyme's disease education. The Community Health Collaborative meeting that we talked about, we have our Franklin Family Wellness Day, which I put some of the flyers across the way on the table for you guys. So that is coming up on May 20th, so right around the corner. We, from community feedback, have brought it back for another year. Everyone claims they want a walk run. We'll see if people actually show up. So I don't know, registration's looking really low, and we're doing everything we can to try to encourage and promote this. This may be the last year that we do it because we've now trailed along 4 years with high verbal demand and then low follow-through of registrations. But we tried to do a different spin on it this year of having the same 2-mile walk through Lion Legend, but then also standing up a wellness fair because we thought, okay, at least maybe then if people don't necessarily want to do the walk, they can get resources. So we'll have a whole host of people and organizations doing wellness fairs. So the library, PD, the Franklin Police Department, we'll have the Davidson family doing the Yell and Tell for child safety. We'll have Volition Franklin there. We're doing free button making, tie-dyeing, jump in if I'm forgetting things, Ellen. Promotion of our walking guide.
A few different senior living organizations.
Yeah, the YMCA. So we've dropped flyers off, or staff or volunteers have, at all daycares, or many daycares, many senior living facilities. The YMCA is promoting because we really wanted to do that, again, multi-generation. So we're doing discounted rates for seniors and then discounted rates for really young kids. And it's about $15, I believe, for the registration. And the wellness fair is free. So we'll see. We're telling partners, push it out as much as you can this week. If we don't have registration, to at least 50. We're bringing it back to the planning team, but I'm sure we're going to cut it because we're using a lot of police auxiliary time, and we can't really justify that if we don't have enough people. But we can still go on with the wellness fair. So we do plan to go forward with that and hope that we can serve the Franklin community in the way they want. So we hear that this is really what people are looking for. We'll continue to gather that information. And then one other piece is we are most likely having a civic health table, so people can learn how to be engaged in a healthy way with your local government and civically involved, because we feel like there's a barrier there. Maybe not everyone knows how they can be, and we're bringing in Alder District map and helping people learn who their Alder person is and all things Common Council related. So looking forward to that. And then just ending with a projection into June, because right away at the beginning of the month we'll have our long-standing Franklin Bike Rodeo, which is already through the roof for the registrations. So we are very excited to have a lot of people willing to come to that.
About how many?
What is
Probably close to 70.
Yeah, it was
just under. Yeah.
Yeah, it's great. We have no problem ever filling that, and almost it's overfull. Usually we're trying to piece people in where we can and get more volunteers. So we're really excited to have that. But I'm open to thoughts on how this presentation looks to bring to the Common Council. If you feel that it's maybe missing anything, if we should include more about something, less about something. Happy to hear what you guys may want to see go to council next week.
Anybody, any comments?
I think it looks great. I think it really touches on everything I feel like we talk about during the year that you highlight you're doing.
My only comment would be if you add little paragraphs about the service summary describing them. I know you'll do that verbally, but if someone was to take this home, they might just not know what they mean, and so kind of what the department does.
Sure. Just to clarify, you mean in this service?
Yeah.
Thank you.
I like all the initiatives that have been, this is kind of letting the community and the council know what kind of things you're doing. If there could just be more detail into that in terms of your presentation for each of those. Make it more of a personal thing, or how it relates to the community, and be effective in the community that way. So each one of them it can stand on its own, but just as far as sharing an explanation for novices like me to understand, would be good.
I will do that. Thank you.
Okay, anybody else? Okay, hearing none, we'll go into the environmental health updates.
Great. I actually might want to back up just to lay this under health officer report. I just wanted to report out too on the end of the public health emergency. So that is coming, as all of you know, on May 11th of this month. So it's the end of the national declaration of the public health emergency, which consists just of a lot of different wind down of services. There's a lot of different information online. A lot of things are being released from DHS. We don't necessarily plan to release anything extremely detailed into the community because that would be 100 and hundreds of pages, but we are prepared to answer questions at the health department if people have them, or help direct them to resources. But some of the key things that I wanted to let you guys know is that similar to how the Department of Health Services currently reports on respiratory illness for the state, they'll be planning to do that for COVID-19 numbers as well. So that's still being tracked. We're still tracking it through our internal systems because we have to follow up on all communicable disease. So we'll have our report outs in our Board of Health meetings still. The state testing programs have already been winding down, or they've already ended, and state-funded COVID-19 testing has already started to decline. So we have written to be in the NACHO pilot to be able to offer free at-home tests. So we did apply for the minimum of 250 tests just to be responsible stewards of that, because they had an estimated expiration date of about 2 months. So we've been making an internal procedure of how we will get those into the Franklin community and how many per person or per family we'll be giving. So we're finalizing that policy and thinking that our shipment of tests will most likely become available within 3 weeks. So stay tuned for that. And then if we're successful in that and there's an interest from Franklin community, we'll then plan to apply for more tests as well. And then just one other thing that I thought was interesting to note is that private insurance companies are required right now to cover COVID-19 tests without copays or coinsurance, and that requirement will end. So we do expect that there may be an uptick in individuals who are looking for that at-home test, just to have awareness of their health status. But if you guys have any questions off of that as things start to unravel, feel free to call the health department or connect with the health department staff, and we'll try our best to find you guys an answer.
Can I also ask about the youth mental health first aid?
Sure.
That's on the agenda?
Oh, well, that was actually in the minutes from
Oh, that was
Oh,
on
from
the-
April,
last.
yeah.
Yeah, last month.
Oh, okay, sorry. I'm looking at the wrong paper.
Do you want to hold that for?
I can ask aside after the meeting, I can ask someone.
That's wonderful.
Yeah.
Okay, thank you. And then environmental health updates.
Yes.
Thank you, Henry. Environmental health updates, I really don't have many. I left this as a standing item on the agenda in case we had any environmental health complaints from our retail food establishments. My main update is that we did send through those renewals for licenses this year. So that goes to all licensed establishments to renew by June 1st, which is the beginning of the license year. So those are out, and we expect those to become rolling in to the Franklin Health Department, and that helps us track our inspections and the different establishments here locally.
Okay, is there anything else anybody wants to bring up? Hearing none, we need a motion to adjourn.
I'll make a motion to adjourn.
And second,
Second.
any discussion on it? Hearing none, all in favor?
Aye.
Okay, this meeting is now adjourned.